Welcome to my presentation on Thorazine. The generic name is Chlorpromazine. Thorazine is an antipsychotic medication in a group of drugs called phenothiazine. It works by changing the actions of chemicals in your brain. Here are the liquid and pill form of Thorazine. The active chemical in this medication is hydrochloride. These are the chemical trade names for Thorazine: Contamin, Hibonol, and Megafen. There is no street name for Thorazine. Thorazine is an unscheduled drug that can only be prescribed by a licensed healthcare professional. Here, you're looking at the chemical makeup of Thorazine, along with its molecular weight and molecular formula. Take a look at this ad. It's almost as controversial as the drug Thorazine it promotes. This just isn't showcasing outdated values. It's an advertising that showcases the beginning of a mental health revolution. Considered a breakthrough medication, Thorazine secured FDA approval on March 26, 1954, as the first psychiatric medication. Thorazine was the result of researchers in France trying to find a magic bullet for the disease malaria. Instead, they found a sedative thought to be potentially useful for surgeries. This is how Thorazine is manufactured. Thorazine needs to be stored at room temperature, stored away from heat, moisture, and light. And of course, with all medications, out of the reach of children. Thorazine helps to reduce agitation and psychotic symptoms by targeting dopamine receptors in the brain. Dopamine is one of many chemicals in the brain known as neurotransmitters and is believed to play a role in individuals who are experiencing hallucinations and delusions. Dopamine is a natural compound that is involved in transmitting messages between brain cells and involved in regulating the mood and behavior. Thorazine also affects the dopamine receptors in an area of the brain that causes and controls nausea and vomiting. Thorazine can be taken in many forms: by mouth with a pill, or the pill being placed between your cheek and teeth, in your rectum, directly into your muscles, intramuscular, and through a needle in your vein. Although the plasma half-life of Thorazine itself has been reported to only being a few hours, elimination of the metabolite may be very prolonged. Long-term use of Thorazine has been linked to sudden and unexpected deaths. With any medication, there are bound to be side effects. Thorazine can impair your thinking or your reactions. Be careful doing anything that requires you to be alert, like driving, watching children, studying, paying attention in class. Avoid getting up too fast from sitting or laying down. Avoid drinking alcohol, and avoid being exposed to the sunlight because Thorazine can make you sunburned real easily. There is always potential for abuse and addiction with any medication, but you need to monitor your intake, follow the directions of your healthcare professional, and take the medication as prescribed. These steps will lessen that potential. If there's an overdose, allergic reaction, or a misuse of Thorazine, you need to seek immediate medical attention by calling Poison Control at 1-800-222-1222 or the emergency room 911. And make sure you follow their instructions until help arrives. Thorazine is used to treat psychotic episodes such as schizophrenia or manic depression and severe behavioral problems in children. Thorazine helps you to think more clearly, feel less nervous, and take part in everyday life. It can reduce aggressive behavior and the desire to hurt yourself or others. Because it's an antipsychotic medication, which means it can shut off DA receptors, this basically makes Thorazine an anti-recreational drug. Here's a list of related drugs to Thorazine. Chlorpromazine treats schizophrenia. Chlorpromazine treats nausea, vomiting, anxiety, and schizophrenia. Chlorpromazine treats schizophrenia. Chlorpromazine treats psychotic disorders, anxiety, and vomiting that's caused by having chemo. And then there's Chlorpromazine, which treats schizophrenia, vomiting, and nausea. I'm calling this section, Did You Know? Did you know that Thorazine is recommended in excitable pigs, especially those reluctant to accept their newborns? Did you know that Thorazine has been used in the capture of African lions? And did you know that Thorazine is approved as a prescription by the FDA to be used in dogs and cats for its sedative effects? These are just a few of the amazing facts that I found out about Thorazine. There are a lot of information related to Thorazine's use, abuse, history, makeup, structure, and the list goes on. Here you will find a list of the resources and sources that I reviewed and used in putting this presentation together. Thank you for your time and attention.